The Royal College of GPs in Australia have released really fantastic guidelines on how to manage nutrition and health in all of their patients and all of us. They're called the SNAP guidelines, and simple modification of the SNAP guidelines is pretty much all you need to do to take the pressure and stress out of looking after a patient after weight loss surgery. So the SNAP guidelines are smoking, nutrition, alcohol and physical activity. So all of our patients, we're concerned about these issues, and simple conversations about reducing alcohol, stopping smoking, focusing on eating healthy food and doing at least the minimum amount of exercise. It's advice that we all give our patients. Now you can modify the SNAP guidelines by adding another 2 letters and call it the SNAPS guidelines because it's simple. So with a post-bariatric patient, smoking increases your risk of stomach ulcers, as do non-steroidals. So patients who smoke or take non-steroidals after bariatric surgery should be on a proton pump inhibitor to prevent stomach ulcers, which cause a lot of pain and complications, as you know. Nutritional advice is much the same. Alcohol advice is much the same, except that patients with the larger procedures like sleeves or bypasses, if they drink too much alcohol, the alcohol has a different biological effect, and that biological effect means that their risk of alcohol addiction and possibly suicide is greater. So any patient with a weight loss operation who develops an alcohol problem needs to be taken very seriously. Physical activity is also important. Now the other 2 S's for the SNAPS guidelines for post-bariatric patients relate to supplements and symptoms. Any patient who's had weight loss surgery has had their gut anatomy and function changed, probably permanently. And part of that change in gut function means a reduction in efficiency at absorbing some vitamins and nutrients, but also a reduction in intake, and the 2 things can combine to lead to late nutritional disturbances. All of our post-surgery patients need to be on a regular multivitamin and need to have yearly blood tests looking at their iron, vitamin D, folate, B12 and other vitamins or minerals if they're important. The last one is symptoms. Surgery changes the way your gut functions, and this can lead to symptoms or side effects in some patients, and these side effects will often occur 5 or 10 years after surgery. The most common one is heartburn or reflux. If a patient who's had a weight loss operation presents with heartburn that isn't easily controlled, you can guarantee that the problem is the weight loss operation, and that patient should probably be assessed to see if there's a complication occurring. The other thing is abdominal pain. Some patients, because of the change in their gut function, are at risk of bowel obstruction or loose bowels. And again, if patients after weight loss surgery turn up with abdominal pain, it's important to have a conversation with them about whether this might be related to their previous surgery.